No, thank you for sharing all that. And I'm glad you touched on, this whole idea of setting the foundation for health and this whole idea of, excess acidity and how that usually, leads to a lot of symptoms. And so, Dr. Klinghardt, for his lecture on the summit, talks about autonomic response testing and how that works. And many of us who are in the field of treating people with complex chronic illnesses, we all have our tool to really check in with the body and figure out how we can prioritize treatment. And so if this is a new concept, if you're listening, many of us on the front lines who are treating patients, we wouldn't be able to see the results, I believe, that we all do if we didn't have a technique like this to check into someone's individual body and prioritize. Because without that, you're just really guessing. You're just making educated guesses. So, and I just like to share here too, like many patients find us after seeing 20 to even 50 doctors. And so they have had this opportunity for that other methodology to work. And unfortunately for chronic illness, we're left short with results because there isn't that acknowledgement, or I think that the paradigm isn't there to, for every doctor to check in with the patient like you're saying. So I just wanted to put that out there. And so Dr. Garcia, you're talking about obviously using magnets, and it's very specific, and it's they're used in pairs. They're not used alone. And
correct.
The light bulb for me that has turned on hearing you is how you're increasing flow and drainage and circulation, to the areas where there are problems. And ultimately, I do see a foundational piece of why people are sick is this lack of proper lymphatic drainage, lack of microcirculation, low oxygen in the tissues. And so can you talk a little bit more about, how, these paired magnets, what you've seen with increasing lymph drainage? And what I'm hearing is that you can get a symptom improvement pretty quickly, but is this something that you maintain the results, or do you have to do repetitively? Do you teach patients to do this at home, or is it always in a clinical setting? But just sharing a little bit more about that.
Absolutely. There was kind of a barrage of questions that you
asked. And I didn't mean to overload you, but just about, please do. And so I just, go with wherever you want, but this whole idea of how to, just breaking this down for the listeners so they understand what's happening.
Absolutely. So in my sessions, particularly, depending on the issues, the imbalances that I find, I prefer that the patients take home magnets with them so that they can reinforce the work that I have done and continue the progress going. At the same time, in the majority, I will find certain infections and have to recommend that, this cough that you have had for the last 6 weeks, that you've taken numerous antibiotics and it hasn't worked, I feel energetically that other family members are sharing it. So even though we could do a culture analysis of the phlegm that comes out and say it would come negative for strep, I still find the pH imbalance that's left over from that strep infection. So they received antibiotics and it, quote unquote, may have eliminated the strep, yet the inflammation is still there. So they may go, another 4 weeks before finally the cough goes away, but it's now a reactive cough. It's just inflammation that's left over and the body hasn't recovered appropriately. So through the use of magnets, I simply restore the pH and the body heals, sometimes instantaneously within minutes. Other times it may take 24 hours. Other times it may take 2 or 3 weeks. It depends on, how much inflammation there is and what other underlying issues are occurring. But oftentimes, so the mother took the antibiotics, she still has the cough, yet one of her sons also has the cough. He hasn't taken antibiotics, but if that mother goes home within 2 or 3 weeks, her son has given her back the strep and she persists with strep and she'll take other antibiotics, yet it is now inside the home and it's going from child to the husband, back to the mother. And so it just becomes a merry-go-round. And 6 months later, the entire family has been on antibiotics, and it just around and around and around it goes. And so by having them take home magnets, she can place the magnets on their lungs, on their pleura, on different areas of the body to help stabilize the pH imbalance where either the strep infection was hiding out or where it was causing the most inflammation, whether causing the reactive cough or the phlegmy throat or the postnasal drip, you name it. And so that way we can take care of the entire family, and that way her issue will go away much faster. So it's not necessarily focusing in biomagnetism therapy on the symptoms as much as the underlying issues. And so that's where, unfortunately, conventional medicine errs, because they focus just what's your symptom. You have a headache, let me give you an anti-inflammatory so that you no longer have a headache. No, you still have the inflammation. It's just your body can't feel that symptom. You've turned down the volume. You haven't actually solved anything for that individual, much less raised or stimulated their immune system so that their body can overcome whatever was causing that in the first place. And so the mental focus should be, okay, why is the body responding with inflammation in that particular area? Is there an infection? Is there an emotion? Is there a nutrient deficiency? Is there a toxicity overload? What is going on? And so through the work of biomagnetism and the bioenergy work that is done with it, you can determine exactly what is going on. And so in some individuals, they have a massive headache because of underlying emotional issues that they have. They're going through a major divorce. And as much as they don't want to admit that all that stress is causing that, they can take all the painkillers they want, but that emotional stress that they're going through is what's causing that. And so everyone is different, but once again, using the bioenergy work and learning how to think about disease and health in a different light is just so amazing for patients, because once again, they've been for years suffering from a lot of these things, and nobody has been able to come up with an appropriate solution until you start thinking outside the box and stop thinking about, well, let me just turn down the volume, because ultimately the volume is going to be raised in another organ, in another area, through a different mechanism, and the body is just going to continue to keep trying to talk to that individual and show them different signs and symptoms, yet they're going to take another painkiller, something else that's stronger. And so ultimately you're throwing the body off in many more ways, on a chemical level, on an energetic level, on a nutritional level, because you continue eating the same foods that are unhealthy for you. And just to give a few examples, and once again, everyone's different, but I personally do not leave home without my magnets, like the American Express card and others never leave home without them. And so this past 4th of July, we went up to Lake George with friends, and it's a huge lake upstate New York, and you rent the boat and you go out for hours. And so I took my magnets and I put them in my pocket, and I said, I never know. I never want to, be without them. We rented the boat. We were on the water 5 minutes, and my friend's wife said, I think I have to go back to shore. I'm feeling nauseous. I'm seasick. Sorry to do this to you guys, but, I'm about to lose it. And I said, wait. I have my magnets. And I pulled them out of my back pocket, and everyone was like, no, you did not bring your magnets. Of course I did. And so I said, okay, this should be easy enough. And so in her case, I grabbed her arms, because you can do the muscle testing through either legs or work with the person's arms. The arms, not only can you do the muscle test of when you try to push it down. That's the typical ART. Or you have them make a fist. And so if there's a positive response, one arm will contract relative to the other, or it will actually extend relative to the other. So in this case, I simply grabbed her arms and I asked her body very specific questions in terms of what is the underlying cause of your imbalance issue? Why are you getting seasick? Is it due to an infection, an imbalance in pH, this, that? And I got my appropriate responses. And so I figured out that I needed to place 2 magnets behind her head in this particular direction, vertically, one black magnet on her medulla oblongata, the brainstem, and the other magnet on her cerebellum. And fortunately, she was wearing a baseball cap, so I slipped them underneath. And then I asked her body energetically, will you require another pair of magnets in order to alleviate this seasickness? Her body responded no. And so I asked, okay, how many minutes? 18 minutes. We had to leave the magnets on. And so I said, in how long will she receive improvement? And so I muscle tested, used the bioenergy technique, and responded in about 8 minutes. She'd start to feel better. So I said, all right, let's anchor down. Let's wait about 10 minutes, and then we'll start the boat back up again and see, how she feels. And so we did that. And then she said, I think it's gone. We took off full throttle, and her seasickness was gone, and we were able to continue with the rest of the 3-hour boat ride. And so, all it took was less than 20 minutes of leaving the magnets in the back of her head. And so she no longer needed to take any type of medication or look for acupuncture points in the wrist or elsewhere. It was simply a matter of placing 2 magnets in the exact location that her body responded where she needed it. And so because of that particular location, amongst the answers and questions that I did, I was able to figure out that she had scrambled eggs that morning, and they were a little on the raw side. And so it was because of those eggs, they happened to have been contaminated with a particular virus that goes to the cerebellum and causes some equilibrium or balance issues. And so once again, that was solved, pretty quickly, and we were able to enjoy the rest of the afternoon on the boat.